Good afternoon. My name is Nicole Miller. I'm a staff nurse 2 in the Cardiac Intensive Care Unit at Boston Children's Hospital. I've been a nurse for 30 years, with 22 years in my current role. Today I will be walking you through how the ICU CAMEO is documented in our electronic medical record. At the bedside, we use CAMEO to capture nursing workload and patient acuity. This information will then be conveyed to the unit leadership for use in staffing decisions for both short and long term. As I begin my shift, I open the medical record in Epic and I can review my patient's CAMEO scores over the course of their hospital stay. Towards the end of my shift, I input scores based on the current status of the patient. I will walk you through how this is done now. So let me walk you through completing a CAMEO entry for a 4-day-old patient on post-op day 3 following his stage 1 repair for hypoplastic left heart syndrome. This is a simulated patient within the Epic platform for training purposes. I start by logging into the patient's chart, where I will find the CAMEO tool that's built into the Epic platform. As you look at the graph, you will note that this patient scored at high levels of 5. Which is here in the red. 5 is being the highest acuity. For purposes of early recognition, we have this graph color-coded for reference. As you can see, the classification table is colors coded below. Now let's complete the CAMEO, which we find in the patient's flow sheet. As I complete each section, a reference guide available to help me. Starting from the top, I will first assess the patient's behavioral and clinical status over the shift. My patient exhibited signs of pain and agitation, so I need to escalate care. During my shift, I did not have to resuscitate him. At Boston Children's Hospital, we practice patient-family-centered care. These families can be at the bedside for 24 hours a day. They're walking into new complex and stressful situations and may need more support in teaching to go over their baby's status, condition, and plan of care. I needed to escalate the care because they were crying and they needed more support than usual. They were complex, so it took more than an hour. With our vulnerable patient population, we need to watch their fluid status closely. This patient is on diuretics, so it's crucial for me to follow his eyes and nose closely. So I'm doing every 15 minutes. Our vital signs are a combination of non-invasive and invasive, which are monitored frequently. We make crucial decisions with this information. I monitor his non-invasive every hour, but needed his invasive to be more frequent, since I gave more diuretics and had to titrate his medications. During my shift, I gave my patients 6 intermittent medications. So we fell between 1 and 10. Most of our patients are on multiple vasoactive medications. That's inclusive of vasopressors and inotropes. A patient may be on 3 or more of these medications. My patient today is on epinephrine, nipride, and narcardipine, so I will score him at a 3. My continuous medications include the pressors, sedations, continuous flushes, and IV fluid. He has more than 5. Respiratory complements the different levels of support that the patients are on. My patient continues to be intubated with conventional ventilation. My nursing assessment includes lines, arrhythmia management since he's paced. He has complex dressing care because he does have an open chest that needs frequent assessment. He also has a couple chest tubes and a peritoneal drain. I will score his ADLs at a 6 due to the number of tasks that were completed, such as oral care, diaper changes, repositioning of the patient, and a linen change after procedures. My patient was a full-term baby, and at this time he has not been developmentally delayed, diagnosed with any developmental delays. So, not applicable, and he's age appropriate. In the ICU, many procedures are completed. I will score him greater than one procedure because he had chest x-ray, we had to insert a peripheral IV. We did, fortunately, able to close his chest today and placed a wound vac over his mediastinal incision. So greater than one procedure. And collectively, during my time, the procedures did amount greater than 2 hours. I did not have any transfers, admissions, or transports in my patient care today, so this is non-applicable, and non-applicable because there's no time. Coordination of care. I needed to coordinate the baby's care today. Mom is pumping and not all of her milk has come in, so I needed to call lactation. My parents asked questions related to his medication, so education was needed. Social workers were contacted so that we could help support the family, and we wanted to start some trophic feeds on the baby, so we contacted our dietitian. So approximately about like 6 to 10 of those today. And these, when you try to coordinate everything, it was over 2 hours for that. Our professional environment management today, I ended up precepting an experienced nurse. We did end up attending a family meeting to update the family about their baby's condition and their plan of care. I did have to give a complex bed shift report, and I also needed to provide supportive care to my neighboring nurses. The time that I spent during my shift was well an hour. I now have completed this, so I will go and file. And then once it's filed, as you see here, it does give me a total score and then a number in the category. If I go down to 5, it shows that he falls in the red. With this information, I'm able to speak with my charge nurse about that this patient has become sicker or was just more intense with his care over the shift. And as we look at the summary will, the trend here in the graph will update, and it shows that this baby does have a higher CAMEO score than previous. Walking through this instruction took some time, but as a bedside nurse, it takes approximately 1 to 2 minutes to complete. Thank you.